Thank you for joining us for this webinar, Canine Vaginal Cytology, to aid your breeding successes. My name is Shelley. I'm the content manager at Revival Animal Health, and I am very excited because today, Revival's Director of Veterinary Services, Dr. Marty Greer, will be giving a practical look at vaginal cytology in dogs. It's one of the most valuable tools for predicting ovulation and breeding timing. Dr. Greer has more than 40 years experience in veterinary medicine with special interests in canine reproduction and pediatrics. She received her Doctor of Veterinary Medicine from Iowa State University in 1981, and she has served as Revival's Director of Veterinary Services since 2019. So welcome, Dr. Marty Greer.
Vaginal cytology is kind of a fun tool. There's two reasons that I think you should learn how to do vaginal cytologies. This may be this may be your vet tech, but there are two reasons that I think you should learn this. One is to determine when to start your progesterone testing, because I think a lot of times we're doing progesterones that aren't necessary, and whether you're doing them yourself or having your veterinary clinic do it, it's still costing you money. Second is to look for any kind of pathology in the reproductive tract of the female so that you can determine if there's something going on that shouldn't be happening and therefore intervene. So it's been less than 20 years ago that we were able to do rapid progesterone testing in-house. When I first started doing canine reproduction in the 80s, the only tool we had was vaginal cytology plus the male and female's interest. But at that time, we weren't using frozen semen. We weren't scheduling C-sections. So a lot has changed over the last 40 years. But it's only been less than 20 years that we could get a progesterone result in less than a week. It used to be we'd have to send the sample to Michigan, and then they would send us a result back because it would take them some time to run it. And so if they only ran it once a week, which is what all they were typically doing, it would take us way too long to get a result. Now, if my staff has to wait more than 8 minutes, they're drumming their fingers on the counter at the machine saying, what is taking so long? So I think it's important that we realize the significance of the changes and what the value of progesterone is. Now, in no way am I saying vaginal cytology should replace progesterone testing. Progesterone testing is still essential. Quantitative progesterone testing, not semi-quantitative, is still significantly important for sophisticated breedings such as fresh chilled and frozen semen breedings, for high-risk pregnancies, and for planned C-sections. So a high-risk pregnancy is one where maybe she only has one puppy, or maybe she has 14 puppies, and you need to plan a C-section. A high-risk pregnancy is one where she's resorbing puppies, or she's sick, or she hurts herself, or she gets, beat up by another dog, which happens. All the things that we need to know about that make her high risk. Did she hurt her back during the pregnancy? Did she end up with Lyme disease during the pregnancy? Did she have something else happen to her that now puts her in a high-risk category? And you need to know where her due date is so that we can intervene. If we have to supplement with progesterone, if we don't know the endpoint of when she's actually due with a progesterone level, we can't do some of these important interventions to manage and save high-risk pregnancies. So I am not saying to replace progesterone testing. I am saying to augment progesterone testing, to give you additional information, to save you a little bit of money on things, maybe to save you some trips back and forth to the veterinary clinic if you learn to do this yourself, or if you have a vet tech that's involved with it, because there's a lot of things that you can do with it. It's also pretty useful if you have dogs that you don't think are having heat cycles. You can do a vaginal cytology, and I'll show you how to do all those once a week for months. And then you can collect those slides. You can take them in. Your vet tech can stain them, take a look at them, and say, oh, look, back here in October, you didn't realize it, but she had a heat cycle. So now if you know she has cycled in October and you expect her to cycle again in April, starting in March, you can start doing vaginal cytologies, get those results back quickly, and then start to know what's going on. So it gives you information going forward. It gives you information in hindsight. There's a lot of really valuable information that we can gather from vaginal cytologies without having to do progesterones. All right, so progesterone is really great for timing females, but it's not the only thing that we can use. Unfortunately, your veterinary clinic staff does not have a crystal ball. They cannot just look at the calendar and tell you what's going on. And they can't look at a progesterone level of 0.2 and tell you what day is she going to ovulate on. When she gets to between 3 and 5, we can start predicting those things, 3 to 5 on the progesterone. But when her progesterone is 0.2, or when she hasn't come into season yet, we don't have a way to time it. So I think it's important that you know that, and that it's important that we understand how the heat cycle actually works. So the vaginal cornification is what we're talking about in this webinar. And that's that blue line that goes up at a nice 45-degree angle, goes flat across the top, and then comes back down. So the way vaginal cornification works is that as the female enters her heat cycle and there's a bloody vaginal discharge, her vaginal lining goes from being thin and these nice round cells, which I'll show you pictures of, to thickened cells that protect the vaginal vault, the vaginal lining from the tie of a mating. So it's physiologically functional that our females have this cornification to protect them during the tie. And it's of course different than it is in humans and in other species because those other species don't have ties. So the estrogen level is what actually initiates the heat cycle. So around 6 months from the previous heat cycle, you're going to start to see an estrogen rise. Now, nobody is running estrogens in-house. There is no estrogen assay that can be done in-house. There are a few reference labs that can run them, but it is not used in a clinical setting most of the time. But this is important for you to understand is what role each of these hormones play. So estrogen at the start of the heat cycle rises. It causes the eggs to start developing in the ovaries into items that, ovary structures that can become fertilized. So the estrogen goes up. And then as the estrogen drops, then we start to see an LH peak. LH stands for luteinizing hormone. The luteinizing hormone is actually what creates ovulation. Progesterone does not. Progesterone reflects ovulation, but it doesn't actually cause ovulation. So the LH goes up as the estrogen drops, the LH rises, but the LH peak is very narrow. It's typically about 24 hours long. So unless you are doing LH testing every 24 hours at the same time every day, LH isn't really a useful diagnostic tool. And at one time it was. At one time, it was one of the first hormone assays that we could do in-house. Before we could do progesterones in-house, it was becoming a thing. ICG back in the day developed this test and it was useful. But it went off the market, then it came back. And so over the course of time, a lot of people haven't used it because of the need to do these every 24 hours and the fact that when it wasn't available, we kind of became more dependent on progesterone. And as many of you know, progesterones are available overnight from most reference labs. Many veterinary clinics can run them in-house. Some breeders run them in their breeding facilities. So we have progesterones now that we can use. So estrogen rises, estrogen falls, then LH rises, then LH falls, and then progesterone rises. As the progesterone starts to go up, that's when the vaginal lining becomes cornified. And cornified just means that the cells are changing into a thickened, more durable cell instead of these nice, fragile little round cells. At that time is when the bitch ovulates. And as most of you know, the bitch does not ovulate an egg that is mature and ready to fertilize. The egg needs time, 2 to 3 days, to mature into an ovum that can be fertilized. That is different than any other species. Canines, so foxes, wolves, other canines, dogs included, have an egg that they ovulate that is not mature. As soon as the egg matures, then they enter their fertile period. At that point, then the cornification starts to drop back off. So this kind of gives you a visual for when the vaginal vault is cornified and what those cells are going to do and look like. So when we talk about these cells looking at it under the microscope, you can understand how this all works together. So that's what we have for the stages. There are 5 parts of the estrous cycle in a female. Like I said, they need 2 to 3 days to mature. And there are 2 terms, estrus and estrus. And this is a little confusing because estrus with an O is the entire cycle of the female. Estrus without the O, ESTRUS, is the fertile period during which the bitch is in heat. So again, these are terms that you need to know, but aren't necessarily going to be using on a regular basis. So a vaginal cytology or vaginal swab is done by taking a swab, a long-handled, basically Q-tip, a long-handled Q-tip, sliding it upwards into the bitch's vaginal vault, spinning it around in there, collecting some of the cells in the vagina, and then bringing it out and putting them on a slide, staining the slide and looking at it under the microscope. So this kind of gives you a 3D cutout picture of where the swab is going to go. So it has to go in fairly far, and it can, but you don't want to go straight in. You want to go up at a 45-degree angle because that's the direction that the female's reproductive tract runs. So if you try to go straight in, it's not going to work well. If you try to use a little short Q-tip that's 2 inches long, 3 inches long, that's not long enough. You need to have an actual swab that fits into that area. So when we have a female that we want to do a vaginal cytology on, we're going to have her stand. And usually these girls are pretty good because they're approaching standing heat. So they're going to give us some cooperation. So you can see this is our cytology brush and they're sliding it upwards and you kind of have to very gently work it in. Then they're going to put it in as far as they can. Spin it around so that they can collect some of the cells, pull it back out. And then when you put it on the slide, you don't want to smear it across the slide. You want to roll it across the slide. Very important distinction. If you smear it, you break the cells. If you roll it, you just take the cells off of the brush or the swab and put them onto a slide. And once they're on the slide, then we stain it and take a look at it under the microscope. So it's easy to do. It requires very little equipment other than a microscope. And once you have a microscope, you're pretty well set. So if you have a microscope that you do fecals with or a microscope that you do your sperm analysis with, you can use the very same microscope. You don't have to go buy new equipment. If you don't have a microscope, then we can talk about what are your other choices. So we want to use multiple parameters to do ideal timing on our females. We want to do progesterone testing. We want to look at the bitch's behavior. We want to look at the stud dog's behavior. We want to use cytology. Like I said, we typically don't use LH testing anymore. And there are some veterinarians that will do vaginoscopy. They'll put a scope up into the vagina and take a look at how the lining of the vagina changes, looking at it with magnification and with a light source in it. So you have all these different tools to use, but the two that we're going to talk about today are going to be progesterone and vaginal cytology. You all pretty well know that if your stud dog stops sleeping at night and starts yelling all night at you that the female is ready to breed, you should pay attention. You should know if the female runs out of her kennel and runs over to where the male dog is, you should pay attention because that should be some kind of a hint that she's in heat and she's getting ready to breed, or he knows she's getting ready to breed because he's keeping you up at night. So once we have made our slide and we have stained, have it rolled out on the slide, we're going to stain the slide. So we're going to take the slide and we're going to put something on the end like this very fancy clothespin so that your fingers don't turn colors. And we're going to put it in 3 different solutions. This is a diff quick solution. And again, we carry these at Revival. So you're going to dip into the stain fixative 3 times. So this basically 3 to 5 times. This basically puts the cells that you've just rolled onto the slide and adheres them to the slide. So when they go in the next solutions, it doesn't fall off into the bottom of the solution. So you dip it a few times, and then you're going to transfer it into the second stain jar, which is pink, and you're going to dip it a number of times again. And you'll start to see the stain stick to the cells. And then you're going to drain that, and then you're going to put it in the purple. And these 2 colors give you a pretty distinct color on the slide that will help you. So kind of tap that off, go into the third. And again, you'll start to see it change color. Pretty easy to do. Drain that off. And then on the back side of the slide, we always label the front side with the name of the dog and the date that it was taken. On the back side of the slide, you're going to very gently run water over it to get rid of the extra stain. You don't want to run water over the front side because you'll dislodge the cells that you just very carefully stained. So you run it down the back side, then you dry it, and then you look at it under the microscope. So what do you need to do a vaginal cytology? You need a microscope. You need microscope slides. You need long-handled cotton swabs, and you need a stain kit. So these are the 4 things that you need. Of course, you need a female, but those are the things that you need. So it's pretty easy to do, pretty straightforward. And then your stain can be used for other things as well. At our vet clinic, we typically use certain kinds of, we have a stain for clean things and a stain for not such clean things. Our vaginal cytologies are clean. Our ear cytologies may not be as clean because there are going to be bacteria and things like that in it. So we have 2 sets of stains. Your vet clinic may have the same setup. But essentially, any vet clinic that can stain a slide for a cytology, for an ear, for any of the other things that they're doing at their hospital, looking at tumors, whatever, they can do this for you. And if you're willing to work with your vet tech, and we've talked about this a lot before, if you're willing to work with a vet tech that's interested in doing this and learning either to do this themselves or to help you learn to do this, you take them a plate of cookies and you will be golden. They will be more than happy to teach you some of these things. All right, so what do we do with these slides? How do we interpret what we're seeing once we've taken the slide and collected the sample and then put it under the microscope? And we're going to go through the 5 stages of the heat cycle. The first is anestrus, which is when the female is not in heat. So it's when she's a puppy until her first heat cycle, or in the 4 months between heat cycles. So it's either of those time periods when she is in anestrus. Anestrus just means not in heat. At that point, if you were to do a progesterone, it would be less than 1, typically less than 0.2. And the cell type is going to be this big round epithelial cell. The top one is pink, the bottom ones are purple, just depending on how much stain was on them. And so that big epithelial cell is a non-cornified or a parabasal cell. Very common to see these. They have a nice big round nucleus. They're nice big round cells. They're all very happy. And those little purple dots in the background are bacteria. It is normal to see bacteria at this stage of the heat cycle. Absolutely positively, you should see bacteria. You may see some round ones. You may see some long ones. The round ones are called cocci. The long ones are called rods. And that is absolutely normal. This is not anything to be concerned about. This is not a reason to put your female on antibiotics. There should be bacteria there to protect her from bad bacteria. The good bacteria should live there, just like in all of the other parts of our body where we have bacteria, like on our skin and like in our intestinal tract and like in our mouth. So bacteria are normal. Do not overinterpret bacteria. The second stage is proestrus. So this is when she starts entering her heat cycle. And that's going to be in the first 7 to 10 days of heat. So you're going to see a bloody vaginal discharge if the female's not keeping herself clean. Now, I have some of my own dogs that keep themselves so clean, it can be really difficult to tell. So at this point, the progesterone is going to be lower. It's going to be higher than anestrus. It's going to be about 1. And once you get to 4, then we're going to say that she's entering estrus. So proestrus is the start of the heat cycle. The cell is starting to look more angular. It's not as round. It's not as pale staining. It still has a nucleus, but you can see the edges of it are starting to get a little bit more angular, like a potato chip. They're still kind of fried egg looking because they have a nucleus. And I'm not supposed to use food terms to describe cells, but it's easy. So you can see the nucleus, the fried egg part of the cell is the nucleus, that center part. And then in the background, those little ghosty gray cells that are round without a nucleus, those are red blood cells. Normal to see red blood cells, normal to see bacteria. This is absolutely normal. This is what it should look like in proestrus, and the progesterone is still under 5. Once they get a little further along, they enter estrus. This is when they're actually in their fertile period. This is when you want to start doing your progesterone testing. So when you look at the vaginal cytology, you can see that the cells have lost their nucleus. They don't look like a fried egg anymore. And you can see that they're dark staining and they are very angular looking. They look very different than the round cells that were nice and rounded edges and light staining and had a nice nucleus. At this point, the estrogen is dropped, the LH surge has occurred, and the progesterone is starting to rise. So all those things are happening. The progesterone at this point will be somewhere between 4 and 20, and the cells start to look like potato chips instead of fried eggs. They're angular, they're dark staining, and they don't have a nucleus. Start your progesterone testing at this point, and you should get the opportunity to say, okay, she's been in heat a couple of days now, maybe a week, maybe 10 days. I don't need to do a progesterone on her every single day or every other day until her cells start to look like this. This is how it looks then on some other slides. You can see that this has a few more cells on it. They're not quite as close together. And these cells are now angular. A few of them have nuclei. Most of them do not. There's still bacteria in the background. That's all completely normal. The estrus cycle is going to be several days long that she's fertile using fresh semen, but a shorter period of time. We only have about 24 hours to get frozen semen to work. So if you've waited this long to do a progesterone, you might be a little bit late. You want to start just a little bit sooner than this on your progesterone. Once you get to this, you're really getting close to knowing when she ovulated. All right, diestrus is now at the end of her fertile period. At this point, her progesterone has risen and it will stay high for 63 days, whether she's pregnant or not. At this point, as soon as you get a progesterone above 5, you don't need to continue them unless you're using frozen semen, and then you probably want to do one more. At this point, we should expect to see white blood cells. The white blood cell is that those 2 little cells on the left-hand side of this cell and then one inside the cell with that kind of 2-part nucleus or 3-part nucleus. White blood cells are normal during diestrus. They are not normal during estrus. So if you see white blood cells in proestrus and estrus, you need to talk to your veterinarian about an antibiotic. If you see white blood cells at this point, again, that's completely normal. Do not overuse antibiotics. Only use them if you see white blood cells when you shouldn't see them. And then we get past the fertile period and the cells go back to being round and having their nuclei again. And if you get into this stage, you have missed the opportunity to breed her. This is what we want it to look like after she's been in a heat cycle. You might see this the one day after she ovulates and is fertile, but not beyond that. So just really important to know. Then she goes back into diestrus. So again, here is what we want to look at is our graph, because I think it's helpful for you to see the graph again now that you've seen the cytologies. So estrogen rises and estrogen falls, and then LH rises and then falls. And then we have ovulation, then the eggs mature, and then we have our fertile period. So at the very beginning, when she's got an estrogen rise, the cells are not cornified, they're round, they look nice and round, they have a nice nucleus. Don't do your progesterones yet. As soon as the cells start to get more angular, they lose their nucleus, this is when you want to start doing progesterone testing. Now we will see usually percentages of these cells. So we will say 20% cornified, 50% cornified, 80% cornified. Not every bitch goes to 100% cornification. So you can't always rely on cornifications to go to 100% to tell you ovulation. Some bitches never get there. But when you start getting more than 20 or 30% cornified, that's when you want to start doing your progesterone testing. The other thing that happens during the very peak period of fertility is these cells that are cornified are going to be present in large sheets of cells. You're going to see larger clumps of them all sticking together instead of them all being spread out. So you're going to see big sheets of these cells all adhering together, and that's going to tell you she's getting closer and closer to her fertile period. So these nice sheets of cells tell us they're cornified, they're sticking together, and this is a female that is getting very close to ovulation or has ovulated. So this is when you need to do your progesterone testing. So again, wait. And then when she starts to cornify her cells, this is when to spend your money and make your drive to your vet clinic to get progesterones. So why do we want to do vaginal cytologies? Well, progesterone tests are expensive if you're paying for them at the vet clinic. And if you're doing them yourself, you still have to pay for the reagents, the solutions, all the things that happen. Sometimes it's a long drive. I have clients that drive 2 or 3 hours to get a progesterone level. They live far out in the boonies. It's not a small task to get in the car and drive a couple of hours to get a progesterone. If you really don't have access to a veterinarian, you can learn to draw blood yourself, get a centrifuge, draw the blood, spin it down, freeze it, and then hold those serum samples and run them at the vet clinic or run them on your machine later on if you need to. So if you're doing a fresh breeding and you don't really think you need a progesterone, but if she ends up having a high-risk pregnancy or needing a scheduled C-section, you can go back, pull those samples out of the freezer and run progesterones on them. Progesterone is a very stable hormone. Frozen samples of the serum, not the whole blood, but the serum, the liquid part of the blood, are very good tools to go backwards in time and look at and say, now I need to know when to do the breeding or when to do the C-section, because you need to know when she ovulated. So here's a nice summary slide of what happens during the heat cycle. Again, anestrus is before or between heat cycles. Proestrus are the first few days of a heat cycle. Some bitches are 6 days, some bitches are 20 days. It just depends on the female. And you'll see that these cells go from being nice small cells with rounded edges and nuclei to bigger cells, then to the more angular to where she's actually cornified, and then on into here where she's just leaving her estrus cycle. And as the cells start to round back up and regain their nuclei, that is when you know she's past ovulation. So I hope that that summary slide kind of helps you. So again, reviewing the slides, proestrus is the one on the far left. There are red blood cells, the cells are rounded, the cells are angular, they're light staining, and they have a nucleus. As they enter estrus, the fertile period, the middle slide, you can see that the cells are more angular. They don't have their nuclei. And then on the right-hand side, the cells have regained their nuclei, and those cells in the background that are really, really small and dark purple are the white blood cells, which are normal at that stage. So you should see bacteria and red blood cells at the beginning, not white blood cells. You should see white blood cells and bacteria at the end, and bacteria through the whole thing is absolutely normal. So do not put bitches on antibiotics just because you see bacteria. In the slide, antibiotics are not appropriate for every dog that's in heat. Please do not do that. We do have the books, the pandemic puppy book that's nice for your puppy buyers, but the Canine Reproduction and Neonatology book has a lot of information in it about progesterone testing and about the vaginal cytologies, the cells, all those things.
Before we get to the questions, just a reminder, if you scan that QR code there, again, we've got all sorts of the supplies, many of those supplies Dr. Greer talked about today. Also, just want to let you know, since, we do have a lot of exclusive bundles at Revival to kind of help breeders. A lot of them are geared toward, whelping and breeding success and healthy pregnancies. So here are a few of the samples of the bundles that we have. The Her Edge bundle, the Dr. Greer's Passport to Breeding Success bundle with a little bit of everything there, including that book, her Canine Reproduction and Neonatology book there. So scan that QR code to check out those bundles because they're a great resource, a great way, and you can get all the products you need discounted. So again, a great way to shop there. Next slide, I think, yep. And here's a couple more of the bundles. Again, we have a vaccination and microchip bundle and a whelping bundle. So make sure, again, scan that code, check out those bundles when you do your shopping. Okay, a reminder, we do have a whelping kit at Revival because after you do your canine vaginal cytology, the end result you're hoping is going to be a litter of puppies, right? So we do have a whelping kit. So that way it's kind of a one-stop shop for all your whelping supplies. You can kind of customize it, select what you want, what you need, and then it's just kind of an easy checklist. If you're not sure why something's being recommended, we have little recommendations from Dr. Greer kind of explaining why it's important, what it is. And so check that out. You can either scan the QR code there or go to that link on our website and check out the whelping kit on our site next time you need your whelping supplies. Okay, now it is time for Q&A. So we will start here. Robin says, in 45 years of breeding, she's had 3 bitches pyo while pregnant just after delivery. 2 resulted in a spay. The last one we're trying to treat, and it looks like she'll be a spay also. She's waiting on a culture to come back. They're all different stud dogs. Also had a 7-month bitch pyo on first heat. She's wondering what is happening. Do you have any thoughts on what is happening?
Okay, so if they have what's an infection in the uterus after whelping, that's not a pyometra, that's metritis. That's a whole different conversation. It's a different hormone level. The progesterone is not high at that point. The progesterone is low. That is not a pyometra. That's metritis. That's often from a retained placenta, a retained puppy, and that can be managed typically medically without a spay. A young dog with a pyometra, the first question I would ask is, what do you feed? Because I just had a young cat with a pyometra and she was feeding a raw meat diet. And in dogs and cats, you feed a raw meat diet, they get bacteria in their mouth, they turn around, they lick their vagina or vulva, and bacteria just migrate right up into the uterus. So that's putting them at risk. So if you're feeding raw meat, stop immediately and get them on a dry kibble, or at least a cooked food so that you're less likely to have that happen. And typically it's related to the heat cycle and bacteria getting into the uterus. A 7-month-old female is not unheard of, but it's not nearly as common as that 8 to 10-year-old female. So I would look at what you're feeding. I would look at using probiotics to reduce the risk. I would look at your hygiene, your bathing, what kind of surfaces they're on, and realize that a pyometra and metritis is different. And we did go through that in previous webinars. So that would be a good resource to go back to.
Mm-hmm. Okay, Eva's wondering if you have any recommendations as far as what type of microscope and slides you use when doing this.
Yeah, slides are pretty much anything that you can get. I like the ones with a frosted end because then you can put a name on it. That's the end where it's a little ground glass-like and you can use a pencil and write on it. But any kind of microscope slide is fine. They're standardized in their size. Microscope depends on how much money you're able to spend or willing to spend and what your resources are. Sometimes high schools have used ones that they sell. Sometimes you can find them on eBay, but we do carry some nice ones at Revival, so you can do those. Really, you need more than just a magnification. Like a little magnifier lens isn't going to be enough, but they do make some small microscopes that are effective enough to look at those cells. So typically you're going to spend around $400 up on a microscope. So kind of prepare for that. And if you find, like I said, a high school, that's great. You want one with a light source so that you don't have to try and use a little mirror like back in the old days where you have to like the mirror just right. And you want one with 2 oculars so that you can use your right and left eye at the same time. Using a monocular one is a little hard. You have to close one eye and look through it. It's easier if you can keep both eyes open. So a binocular scope with a light source it needs to be at least a 40 and 100 magnification for the criteria on what you're going to order. Buying a used scope has some risks with it. It can be dirty. It can be not very useful. The oculars can be broken. So unless you really trust your source, you're better off to buy a new microscope. That's not to say you couldn't get a deal, but be really careful if you're buying something used.
Okay. Someone's wondering, for how long can the cornification be 100% cornified before ovulation? Sometimes shows 100%, but she is not ready.
Yeah, it can be several days. It can be 4 or 5 days from cornification to the time that they're ready to breed. But at least you know that's when you should be doing your progesterone testing. It narrows it down for you.
Okay. Someone asked, should I skip heats when I breed or breed back to back? Also, what age should I retire my Yorkies?
Breed back to back. I usually do 2 back to back and then I skip one because I think they need some time nutritionally to get back to where they were. But the current thinking is that a pregnant uterus is healthier than a non-pregnant uterus. So breed back to back. Retirement age depends on the overall health of the dog. I typically don't like to see females bred after age 8. Sometimes USDA and states have specific requirements, so you do need to follow those if you have local guidelines. But normally after age 8, I think they need to retire and just be a couch dog.
Okay. Lila's wondering, with a new bitch who is coming into heat due to another bitch in heat, when should we do a progesterone ad or VC test on her? This would be her 3rd heat and first breeding.
Yeah, so I would start doing vaginal cytologies as soon as you see blood, because there are some bitches that keep themselves really clean or that tend to ovulate really early on their heat cycles. So the vaginal cytology costs you virtually nothing. In our practice, every female that comes in to get a pre-breeding exam and to get a progesterone done has a vaginal cytology at every visit. So that's our guideline, because having the vaginal cytology and the progesterone together give us much better information about when she's ovulating and when she's ready. But if you're doing this at home, this can save you a lot of driving back and forth, a lot of trips. And if you're willing to learn how to do this, it's a wonderful tool to know when you're approaching a heat cycle, being at the fertile period.
Okay. Amy is wondering, how reliable are the rapid results within 2 hours progesterone tests versus the overnight testing from IDEXX? Are the rapid result tests more reliable at certain points in the heat cycle? And how reliable to verify ovulation?
The reference lab is always going to be the most reliable because they have very expensive equipment that runs, $100,000 for the equipment, and they have vet techs and med techs that manage the equipment for quality control. Those are always going to be a better test. But many of the in-office tests are very effective and very accurate. And it just depends on the machine. I mean, we see some machines that are way off, and then we see some other machines that are very accurate. So I can't really speak to it because there are probably 20 different progesterone machines on the market. At one time, we've owned as many as 8. So I've got a pretty good idea what I like and what I don't like, but a lot of it has to do with your vet clinic, how they maintain their equipment, what their quality control is. Ask them if they do comparison testing with a reference lab so that you can know if your tests at their hospital are reliable or not. We do a quarterly quality control with an outside lab to make sure that our results are in the range that they should be. Because I want to give my clients the best information that I possibly can.
Okay. And this next question kind of goes along with that as well. They're just wondering how, if possible, could we have a baseline for progesterone results, since machines are different, as you mentioned, and give different results. He said, yes, I look at other signs, but is there maybe a way of interpreting different results from different machines?
Yeah. Yeah. And there are differences. The mini Vitus machine has a different result than the Toso, and the Toso is different than the Catalyst, and the Catalyst is different than the Immulite. So they're all a little bit different. You need to work with your vet clinic to know what's working, what ranges are giving them good pregnancy rates. And if you're running your own machine, you can ask them to help you with quality control. Again, a plate of cookies or a pizza party for the staff goes a long way in keeping those relationships good with your vet clinic.
Okay. Lynn is wondering, do you lube or moisten the cotton swab first?
I put some saline on it because I think it's more comfortable for the female, but usually they have quite a bit of discharge. I don't put any lube on it because the lube is going to fill those little crevices in the cotton swab or on the vaginal cytology brush, and you're going to lose all your cells. You're not going to collect cells. So do not lubricate it first. You can put saline on it, but don't lubricate it.
Okay. How does vaginal cytology get done and performed when the bitch has an inverted vulva?
Same way.
Okay. Okay. Erica's wondering, can you use crystal violet stain?
You can, but if you're going to go to the trouble of doing this, just buy the diff quick. It's not that expensive. And as long as you keep the jars capped tightly, they'll last you for years. So I don't cheap out on the stain. I think you should use good stain because you get the contrast of the pink and the purple together that you don't get if you just use crystal violet.
Okay. Kind of related question about the stain. Stephanie's wondering, can you use the stain jars multiple times,
Oh,
or
yeah.
do you need to change it for every bitch?
No, no, no. We use those over and over and over. And then if they get dirty, you can pour them out and replace the stain. If they are pretty clean because you were careful with what you put in them, you can just top off the amount. When it starts to get a little bit low, you just add more stain to it. They come in big bottles and then you put them into jars that will allow you to keep the stain in a usable fashion. You have to have a way to dip the slides. You don't just pour the stain over it. They have to dip into the jars like we showed.
Okay. A couple questions about the swabs. People are wondering, do they need to be sterile, hooded, protected?
No.
In that case.
Nope, just a plain swab is fine. It just has to have a long handle. I prefer not using wooden handles. I prefer the plastic handles one because I worry about them breaking off. But they do not have to be hooded. You're not doing anything sterile. And no, they don't have to be sterile because if you've ever looked, the female's reproductive tract is not a sterile environment. Now, they shouldn't be dirty. It's not like they should be laid out on the counter and having stuff on them, but just out of the package they're absolutely fine just straight out of the package.
Okay. Megan says she's read that before swabbing the bitch, the swab should be prepped with saline, which you kind of mentioned. She said, is that necessary? And what kind of saline should be used in that?
Yeah, you can just buy saline, like the contact lens solution at the store where the contact lens stuff is. You don't want to use the ones with a disinfectant in them. You just want straight up saline. And you can buy a squirt bottle of saline in the contact lens department for $3 or $4. And then just flip the top open, dampen the stain, or dampen the swab, slide it in, cap your bottle, keep it clean.
Okay. Somebody's wondering, what heat signs should you look for when you don't have an intact male in the house? They say, my bitch hasn't had her first cycle, and she's always used males to tell me when they were closed, but coated toy breed, so no blood on or panties, and her vulva is covered in hair unless she's flipping
Yeah.
her over and checking every day.
Yeah,
So,
and that's what a lot of people do is they just put a box of white Kleenex next to the dog's crate, and every time she comes out once a day, they just take that white tissue and swab her and see if there's any evidence of swelling, bloody vaginal discharge. Um, those are really your only keys are swelling and bloody vaginal discharge if you don't have a boy in the house. So you're gonna have to watch like a hawk.
okay. Linda's wondering, when staining slides, do they need to dry?
Yes. And
Okay.
you can use a hair dryer, but we usually just set them on the counter up at an angle so that the fluid runs off of them and give them a couple of minutes, they'll dry.
Okay. Someone's also wondering, what else can I use the stains for at home?
Well, it depends on how talented you are. If you look at ear infections, if you look at feet infections, if you want to look at other kinds of tissue samples, you can do that. Most people are just going to use it for vaginal cytology unless you have dogs with chronic ear problems.
Okay. And notice that in your demonstration, you showed brushes, but you've also talked about the Q-tips. Do you have a preference? Is there a pro or con to either one?
I like the brushes. I think we get a little better sample with them, and they have a plastic handle. They've got a little bit more of an abrasive surface, so we pick up cells better, but they can be hard to find. So if all you can find are the swabs, they just make sure it's not a little short Q-tip. Make sure it's long enough, because if all you do is barely put it into the bitch's vagina, you're only in like an inch. That's not going to give you the information you need. You need to go all the way in several inches. Now, of course, a small dog is going to be different than a big dog, but in general, you should go in about 4 to 6 inches with that swab to get the right sample. So I like the brushes, but when we can't get them, which we can't always, we have to use swabs and they're fine.
Okay. Somebody's wondering, if my girl is having a split heat, will there be any identifying factors using cytology?
Right. And with a split heat, you'll see them go into what looks like anestrus. So the cells will go from cornified to non-cornified, and then they'll come back up again, or they may never completely cornify. So those are the tricky bitches, the ones that pretend they're coming into heat. They're just like, nope, just kidding. So they come part of the way in, especially the northern breeds, they'll come part of the way in and then go out, and then 4 to 6 weeks later, they'll come back in. So if the progesterone never gets above 5, she split her heat or she has a cystic ovary. She didn't have an ovulatory cycle. I have a lot of people that see the progesterone go to like a 3.2 and then it goes to 2.5 and they go into this panic mode that, oh my God, I missed her. No, when a bitch goes through a normal ovulatory cycle, the progesterone goes up to above 10 and will stay above 10, usually above 20 for 63 days, whether she's pregnant or not. And I think that's where a lot of people get hung up, is that they forget that the progesterone rises and stays high for 63 days on a normal heat cycle. It does not go up and drop back down. Watch that little dotted yellow line, and that'll tell you what the progesterone should be doing.
Okay. Brandy says, as she is coming into estrus and in estrus, can you check cytology every day?
Yes. That's the beauty of it. It's cheap. And you can do it. If you learn to do it yourself, you can do it at home. It's cheap.
Okay. Let's see. Somebody's wondering what kind of staining is best to use for this. What do you recommend as far as
This, yeah, it's a diff quick stain kit. So it's 3 steps. The fixative is the light blue, and then it goes into the pink, and then it goes into the purple. This stain kit is sold as a group, and we carry these at Revival. This is how you should stain almost any kind of a sample that comes from a dog. So your vet clinic, if they do any kind of cytology in-house, is going to already have this stain kit available. It's not unique to vaginal cytologies. They do this for ears. They do this for lumps. They do this for infections between the toes. Your vet clinic is doing this. Your vet techs at your vet clinic are probably doing this every day.
Okay. Linda's wondering, so what point of the shape of the cells do you breed? And if ovulation is 5 and you wait 2 days, what do cells look like for breeding fresh versus chilled versus frozen?
This. They're all going to look the same. The only thing you can tell with frozen is you have to have a progesterone. You can't do this with frozen semen and not do progesterones if you expect to get a good, successful outcome.
Okay. Linda says she's wondering about the magnification settings on the microscope again, what lens piece to use.
Yeah. So usually a 10x is on the oculars that you look through, and then there's going to be oculars underneath that spin around and you can get different settings. So you just want to have one that goes to 10 and goes to 40 so that it's actually 100 and 400. By the time you add the ocular at your eye and the ocular underneath, that gives you that magnification. So it's typically going to be those 2 settings.
Okay. Someone wants to know your thoughts on the use of the fertile focus for identifying the estrogen surge.
I have not had any success with that.
Okay. Let's see. Lauren's wondering, does it matter that I'm dripping liquid from one container to the next when dipping slides?
No, that little bit isn't going to cause any kind of a problem. And again, this is typically how it looks, is you're going to have just a little bit of residue on the slide when you go from one container to the next, but it's not enough to get your knickers in a twist over. You just kind of let a little bit of it run off the corner of the slide and go into the next. You can see she lets it run off and then goes into the next, but that's not going to cause any problems. That happens every time.
Okay. Catherine says the past 6 litters we have had lately have not had contractions or pushing. The vet described their uterus as flaccid at the emergency C-section. What do we do about it? Is it the diet? She says they are eating Royal Canin.
That's weird. I'd be interested to talk to her to see if they're related bitches, to see if there's any calcium supplementation being done. That's unusual. So I think that probably merits a phone call.
Okay, someone's wondering to please explain again as to why not to test progesterone over 5. They're also wondering, they missed on when we should start cytology during the heat cycle.
You can start cytology on day 1 because you're not going to know otherwise where you're at, because some bitches just keep themselves really clean. I'm not sure if I really understand the following question. You need to make sure you get a progesterone above 5 to assure yourself that she completed a normal ovulatory cycle. I think that's what she's asking. So once you get past 5, I like to get one more progesterone a day or 2 after the 5, just to verify that the progesterone continued to rise. There are occasional bitches. I have one of my own that lives at my house that gets to 5 and then never completes her ovulation, drops back down. That's either a split cycle or a non-ovulatory cycle or a cystic ovary. So you just want to verify that the progesterone continued to rise past 5.
Okay. Debbie's wondering what causes absorption in bitches, and does vaginal infection cause absorption?
Infections can. There's probably 300 other reasons, some of which we don't even understand. It can be stress, it can be diet, it can be infections, it can be hormonal levels that don't stay high enough. Resorptions there's a multitude of reasons for them. It can be cystic endometrial hyperplasia, where the lining of the uterus isn't healthy. It can be poor placental development. It can be genetic mismatches. There's a lot of reasons for resorptions, and I don't have a good answer for that. We can diagnose every one of them. There are some diagnostics that can be done. Sometimes they're uterine biopsies, which is a pretty advanced procedure, but sometimes that's what it takes to determine what's causing the problem.
Okay. Another question about split cycles. I believe you kind of touched on this earlier, but there's just wondering, do all the slide and information apply to the split cycle as well?
It can be pretty helpful to determine, because if you get to this point and she never progresses and never becomes more cornified than this and her progesterone doesn't rise, then yes, you probably have a split cycle.
Okay. Anne says, with frozen surgical insemination, how many days from the insemination would you schedule a C-section for? From the date of insemination or from the LH surge?
I do it from either the LH surge or the progesterone rise, which tells us when she ovulated. It has nothing to do with the day you bred her. According to the literature, pregnancy can be 58 to 72 days long, which of course is not accurate. Bitches are pregnant 63 days from ovulation, plus or minus 48 hours. So 61 to 65 days is normal. I don't schedule C-sections before day 61 unless there's some really, really, really good reason to do it, because you're not going to get good puppy survival. So I don't base my progesterone or my C-section timing on the date of the breeding. I base it on the date of ovulation, because that's what tells us when she was fertile. So she needs to be 5 to 6 days after the LH surge, or 3 days after the progesterone rise is going to be when she ovulated. And then you count from there when to do your C-section.
Okay. Rachel has a question about your Canine Reproduction and Neonatology book. She's wondering, does it have photos of the cornification process?
It's got photos of everything, including some things you might not want to see. It's very comprehensive. So yes, there's a lot of good information in there.
Deborah is wondering, can you use this to get a more accurate timing using a frozen semen surgical?
I don't think it improves the accuracy. I think progesterone is still the backbone of what you're doing for a frozen semen breeding, but it surely helps to make sure that you're at the right place. What's interesting is that the day you want to actually complete the breeding is the day that the cells start to get round. So they go from this to rounded. That's the day you should have done your breeding, but by then you're a day late. So that's a little tricky because you can't go backwards in time. So the cells are typically going to look like this when you do your frozen semen breeding.
Okay. Debbie's wondering, does the age of the bitch affect the cycle activities?
First heat cycles can be a little wonky. Sometimes the females pretend they're going to come. I think I'll come into heat. I think I'll test drive my ovaries. Oh, no, just kidding. They're not ready yet. So the first heat can be a little wonky. And then as they get older, they can be a little bit more unreliable. But bitches do not go through menopause. So they will be able to be bred until they are old enough to die of old age. So do not rely on menopause to keep you from having a fertile breeding. But yes, the cycles are a little less regular as they get older.
Okay. Anne is wondering, why is it that all vets cannot pull blood and send it to the lab for progesterone tests? Is it that the lab that chooses not to run the progesterone? She says it's a common practice for all vets to pull blood to test for multiple other issues. So she's just wondering about the progesterone.
That typically the big reference labs, Antech, IDEX, and Zoetis, are all going to run progesterones. ZN Labs, they all run progesterones. It may be your veterinarian's preference to not have to deal with interpreting them and helping you with a breeding program, but almost every reference lab is going to run them. Now, not every vet wants to run them in their office because they have to purchase equipment and reagents and slides and all that stuff to run them. So they may not want to run them, but if they're willing to send a sample out, there should be very few labs that aren't running them. To my knowledge, they all will run a progesterone.
Linda says, the centrifuge, can you use 4,000 RPM for blood and semen?
Yeah, no, not for semen. For semen, you don't want to go above about 1,200. For blood, you can go up to about 2,500. 4,000 is probably faster than you need, but most of the centrifuges have a little rheostat on them so you can adjust the speed. If you spin semen too fast, you damage it, but blood you can spin faster than semen.
Okay. Pam says she's currently giving the Breeder's Edge in between for her, and she is on day 6 of her cycle. And she's wondering, when do you stop using the in between for her and start the Oxy Mama? She says she plans to breed this cycle.
Okay, Oxy Mama is when they have babies and they're producing milk. So it would be Oxy Mate that she would want to switch to. So as soon as she comes into heat, you want to switch to Oxy Mate. And then when she has the puppies, you switch to Oxy Mama. It's a little confusing because they all sound a lot alike.
They do. And those are products that are part of those bundles. So make sure to check out the bundles. If you use all of them, it's a great way to get all of those products in one thing there. Yeah, that Her Edge bundle has the in between for her, the Oxymate, and the Oxy Mama. So there you go.
Right.
Okay, let's see. Next question. Um, Somebody's wondering, you mentioned a reason not to use frozen semen. Is it
I use frozen semen all the time. I don't think I said not to. I said if you're doing frozen semen, you need to do progesterone testing. Vaginal cytology is not accurate enough for frozen semen breeding.
okay? Sounds good. Cheryl's wondering, do you have a minimum number of litters a bitch should have?
A minimum? No.
Okay. Eva says this is not cytology related, but she's wondering, why do you recommend Metacam after breeding?
Well, there were 2 research papers that show that it improved fertility. So we've seen a good improvement in that. So I've been using that.
Okay. Robin says her bitch is 2 years old. She has frequent split heats. Any suggestions?
I'd look at nutrition, I'd look at supplements, and I'd talk to your veterinarian if there's any medications that they can recommend for you.
Okay. Dorothy's wondering, how would you use right gizmostain instead of the quick stain?
It's pretty similar, so I would just follow the package instructions.
Okay. Connie is wondering, her bitch is in season. Her vet tested Monday 0.04 and today 1.9. Vet sent results and said bred over the weekend. I was not aware she would be close today. Suggestions, please.
Well, typically when they're at 2, they're going to be sometime in the next 5 to 7 days. It could be 2 days, it could be a week that she's going to be ready to breed. So knowing a 1.9 is not accurate enough to tell you to breed over the weekend. I'd get another progesterone on her if that's available to you. Today is Wednesday, so there should still be availability to get another progesterone before the weekend. I don't know if she's shipping semen. I'm not sure exactly what she's talking about doing.
Okay. She's also wondering, do you have any in-home progesterone machine suggestions?
Probably BioNote.
Okay. Again, somebody mentioned the brush in the video versus the cotton swab. You said
Right.
both, you can use really both. So
Right.
there. Let's see. Somebody says they had a female diagnosed with open pyo at the end of her last cycle, confirmed pregnant via ultrasound. When resorption happened between ultrasound and x-ray, discharge began around the day she would have been due, so I took her in. Could this have been something other than pyo if progesterone was already down?
It depends. I don't know what the fluid looked like that was draining. I mean, it sounds like a pyometra, but yes, you can see other things that can happen. Most of the time it's pyometra, but it could have been just a unfortunate set of circumstances that it didn't end up to be a bacterial infection, but the puppies were lost and she had to expel all that material, and it may not have been a pyo. It may have been a pregnancy gone bad.
Okay. Somebody's wondering if you could just talk a little bit more about split heats. What causes them when doing cytology? What do you see different on the slides?
Well, on the slides, it just never goes to 100% cornification and then out the other side. You don't see those cells with the white blood cells coming in. Why do they happen? Because some bitches don't ovulate. Mostly the northern breeds will split their cycles, like the Sammies, the Finnish Laplands, the Malamutes, the Siberians. Those are the most common to see split heats in, but it certainly can happen in any breed.
Okay. Kay says she recently bred a 4-year-old. We worked with a repro clinic. Her progesterone spiked at day 24. We ended up doing 9 progesterone draws. This was her first breeding. It seems like some of these draws could have been avoided. Vaginal cytology was done at each draw, and they're just wondering, how can we avoid so many draws if she is bred again?
Well, you can talk to the veterinary clinic at the next time and say, can we do cytologies until it looks like she's getting closer? Now that you know that this bitch probably, now not every heat is the same, but probably will be similar. she may just be a bitch that's a late ovulator. Did she get pregnant? And that's the biggest question. Did she get pregnant? Because if she did, then 9 progesterone was worth it. If she didn't get pregnant, probably wasn't.
Cheryl's wondering, do you have a maximum number of litters a bitch should have? And what kind of guide is the color of discharge during her cycle? Like it starts out bright red and goes to pale pink?
Yeah, some bitches never stop having blood in their discharge. So sometimes they'll have blood through the entire thing. Sometimes it gets real dark or goes back to a bright red blood after they're bred. So you can't rely on that exclusively. Usually it changes to a light straw color from bloody, and usually the vulva goes from firm to soft when they've ovulated, but not every female, reads the book. Not every female does the same thing.
Okay. Somebody's wondering, they have a girl who after day of 14 on her period, she was 22 PG on a fine care Wandfo machine. I bred her the next day. Again, PG tested her again, and PG was 17, and she was not bleeding anymore. What can I do?
Probably have a phone call about that. I don't really use that progesterone machine, so I don't know how to tell you that compares to other machines. You'd have to do some testing.
If you have an additional question, call our pet care pros, our animal care specialists. They are a great resource. That phone number there on your screen, 800-786-4751. So give them a call. They can help you get the supplies you need for the vaginal cytology. They can also help get you in touch with Dr. Greer or ask your questions there. So thank you again, everybody, for joining us today. We appreciate you taking time to learn more about canine vaginal cytology. Again, I'm Shelly. I am the content manager at Revival Animal Health, and thank you so much, Dr. Marty Greer. Thanks for watching. Make sure to subscribe to our channel so you're up to date with all of our latest videos. If you have an animal health question, be sure to give us a call at the number below, and check out our other animal health videos.